well, first of all, we have health-related programs, and we have both semester options and a short-term option for the summer. So let's start with the short one. The summer program that we offer takes place during the month of July, and students will be taking Spanish for health sciences classes while they are here, immersed in a Spanish-speaking country. And also, they take a course that's focused on healthcare systems in Latin America. And aside from that, there's also hands-on opportunities for students to participate in, because that's one of ICDS's main focuses, not only learn in the classroom, but also learn by doing. So students can participate in community work in health-related organizations or do observational clinical rotations in one of the largest private hospitals in Costa Rica. Why one or the other? Well, it depends on students' level of Spanish proficiency. So basically, those students who have a native or an advanced Spanish level, they can participate in the observational clinical rotations. And those students who are not so proficient in the language, they can participate in the community work in health-related organizations. Our semester program takes place both in the beginning of the year, spring semester and fall semester. And it's like an expansion of this summer program that I already described. So aside from the Spanish for Health Sciences class and the hands-on experience of doing either the rotations or the community work, there's a series of elective courses that students can complement their program with in order to add up to 12 credits. For professional students, we have these fourth-year elective options, which can be of 4 weeks or 8 weeks, depending on the student's needs. And we have those opportunities starting in the month of January, February, or March. In this case, these are more focused on the observational clinical rotations. And we're talking about an opportunity that's open for students who have a higher level of proficiency in Spanish, but we will also, we also offer opportunities to improve that Spanish. So in this case, we're talking about doing some hours in clinical rotations during the mornings, and then some of the afternoons, students can participate in Spanish for Health Sciences classes. In this case, again, it will be like the same, like learn by doing. And sometimes if students have certain questions of a situation they had, let's say in the morning, then they can like deepen that knowledge during the class with the Spanish teachers. So yeah. And it will be, well, so it's students stay with host families also in this type of program. So that also enables them to like improve their Spanish skills even more, not only in a medical context, but also in an everyday context. And they can experience people's realities, get to empathize better with possible patients also, Mhm.
Amazing.
Yeah.
And for fourth year medical students and PA students, what are the clinical specialties they can rotate through during the hospital-based experience?
Okay, so there's several areas in which students can rotate. We usually get, cardiology. Sometimes they can also work in the emergency room, internal medicine, radiology, etc. Sometimes labs also, if that's also their field of interest. So, well, first of all, I gotta say, opportunities to come to Costa Rica. It gives you an excuse to come to a country that I know that it's biased from our end to say that it's an amazing country, but we do believe it, and there's a lot of attractions and a lot of reasons just for visiting Costa Rica. But aside from that, just like following up on what Jorge was saying, our framework, the way in which we have created our programs that gives students the opportunity not only to focus on the academic, but also to have like a panoramic view about the Costa Rican culture, the Costa Rican history, what makes us what we are. a quarter of a century of experience in study abroad programs is also a great reason. The SDGs and IDGs that are also part of our framework, the experiential learning.
Going to show you how to find ICDS's programs on CFHI's website. So go to www.cfhi.org. And if you go to the drop-down menu of all programs and click on in-person, because meaning that you're actually traveling somewhere, you will see ICDS programs at the top of this list. So the Spanish and Sustainable Practices in Costa Rica, Sustainable Development and Social Justice in Latin America, Spanish and Health in Latin America, and Healthcare in Latin America. So check those opportunities out. And if you have other questions, you can email students at cfhi.org.